Last year, one of my clients had a full executive medical private hospital, thousands of pounds. He was told everything looked fine, normal across the board. 4 months later, I ran a different set of tests. His ApoB was dangerously elevated. His fasting insulin was 3 times what it should be. His inflammatory markers were quietly climbing. His testosterone had fallen to a level I would normally associate with a man 15 years older. None of this was tested in his executive medical, none of it. He was a ticking time bomb who had just been told he was healthy. And I see this pattern every single month in my practice. Today, I'm going to show you exactly what your annual health check misses, why the ranges they use are dangerously misleading, and which tests you actually need if you are serious about your health after 40. I am Dr. Mark Holmes. I have 35 years of clinical experience. I practice on Harley Street and I specialize in precision longevity medicine for executives. If you want to understand the science your GP is not telling you, subscribe to this channel. New videos every Tuesday and Thursday. And if you want to see where you stand right now, there is a free executive longevity scorecard in the description. 8 minutes free personalized PDF report. More on that at the end. Let me explain how your annual health check actually works, because most people have never thought about this. When your blood results come back, every marker is compared against a reference range. That reference range is printed on the lab report, and your GP looks at whether your number falls inside it or outside it. If you are inside the range, you are told it is normal. If you are outside, it gets flagged. Sounds reasonable, except there is a fundamental problem with this approach that nobody explains to patients. Those reference ranges are not designed to tell you whether you are healthy. They are designed to detect disease. There is an enormous difference. The reference range is typically built by taking a large sample of the general population, measuring a particular biomarker, and defining normal as falling within 2 standard deviations of the mean. In other words, normal means you're within the middle 95% of the general population. Think about what that actually means. The general population includes people who are overweight, people who are sedentary, people who are pre-diabetic, people who are chronically stressed, people who are subclinically unwell but have not been diagnosed yet. Being normal means you are average among this group. That is all it means. An average in the modern population is not healthy. Average is slowly declining. Approximately 88% of adults have at least one metabolically suboptimal biomarker that sits within the conventional normal range. They are told everything is fine. They leave the surgery reassured, but they are not protected. They are in a blind spot. In longevity medicine, we do not operate on 2 zones, normal and abnormal. We operate on 3, optimal, suboptimal, and disease. Conventional medicine only cares about the boundary between suboptimal and disease. When you cross that line, you get a diagnosis and a prescription. But the entire suboptimal zone, where the real opportunity lives, is invisible to the standard model. Let me give you some concrete examples, because this is where it gets uncomfortable. Fasting glucose. Your GP says anything below 100 milligrams per deciliter is normal. In longevity medicine, we want you between 72 and 85. A reading of 98 is normal to your GP. To me, it is a clear signal that insulin resistance is developing. It tells me we need to act now, not wait until it crosses 126 and becomes a diabetes diagnosis. Fasting insulin. This is one of the most important metabolic markers that exists, and most executive medicals do not even test it. They test glucose, but not the hormone that controls glucose. That is like checking the temperature of your engine without checking the oil pressure. In longevity practice, we want fasting insulin below 5. A conventional lab will call anything below 25 normal. You could have a fasting insulin of 18, be told everything is fine, and be well on your way to metabolic syndrome. ApoB. This is arguably the single most important cardiovascular marker available. It measures the actual number of atherogenic particles in your blood, the particles that embed in your arterial walls and cause heart disease. Most standard blood panels do not include it. They test total cholesterol and LDL cholesterol, which are useful but incomplete. 2 people can have identical LDL cholesterol readings and completely different cardiovascular risk because their ApoB particle counts are different. We want ApoB below 60. Conventional reference ranges go up to 130. I want you to understand the scale of this gap. The difference between a conventional normal range and a longevity optimal range can be the difference between a decade of intervention and a decade of reassurance. One path leads to prevention. The other leads to eventually crossing the disease line and being told you now have a condition that could have been caught years earlier. I use an analogy with my clients. Reading blood work through the longevity lens is like being an experienced pilot reading weather instruments compared to a passenger looking out of the window. The passenger sees clear sky and assumes everything is fine. The pilot reads barometric pressure dropping, wind shifting, humidity rising, and recognizes a storm forming in 4 hours. Same information available, completely different interpretation. So what should you actually be testing? Let me give you the 5 most important blind spots that standard health checks consistently miss. Number 1, fasting insulin. I have already explained why. It is the earliest warning signal for metabolic dysfunction, and most panels do not include it. You can request it specifically from your GP or order it privately. Number 2, ApoB, the real measure of cardiovascular risk. If you have a family history of heart disease, or frankly if you are a man over 40, you need to know this number. Below 60 is where we want it. Number 3, HSCRP, that is high sensitivity C-reactive protein. This is a measure of systemic inflammation, not the kind you feel in a sprained ankle, but the low-grade chronic inflammation that drives every age-related disease, heart disease, cancer, Alzheimer's, diabetes. We want it below 1.0. Conventional labs will call anything below 3.0 normal. A reading of 2.5 is considered fine by most GPs. In my practice, it is a red flag. Number 4, homocysteine. This is an amino acid that, when elevated, is associated with cardiovascular disease, cognitive decline, and impaired methylation, which is a process fundamental to DNA repair and gene expression. We want it below 7. Standard labs will call anything below 15 normal. Again, a massive gap between normal and optimal. Number 5, a complete thyroid panel. Most GPs test TSH alone. TSH is one number in a complex system. If you are experiencing fatigue, brain fog, or weight gain that will not shift despite doing the right things, you need TSH plus free T, 3 plus free T4 plus reverse T3. Reverse T3 in particular is almost never tested in standard practice, and it can reveal a thyroid conversion problem that TSH alone would completely miss. These 5 tests, none of which are exotic or expensive, would fundamentally change the picture for the majority of executives I see. And most of them have never been ordered. But it is not just about individual markers, it is about patterns. When I look at blood work, I am looking for signatures. Clusters of markers that together tell a story that no single number tells on its own. The metabolic syndrome pattern, elevated glucose combined with elevated triglycerides, low HDL, elevated insulin, and elevated uric acid. Each of these individually might sit inside the normal range. Together, they are a metabolic fire building towards diabetes and cardiovascular disease. The inflammatory pattern, elevated HS, CRP, elevated homocysteine, elevated ferritin, and low albumin. Again, each might be normal in isolation. Together, they describe a body under chronic inflammatory stress. The hormonal decline pattern, low free testosterone, elevated SHBG, suboptimal free T3, elevated reverse T3, declining DHEAS. Your GP tests none of these in combination. But together they explain the fatigue, the brain fog, the difficulty recovering from exercise, the declining libido, all the things you have been told are just part of getting older. They are not part of getting older, they are part of not looking in the right places. I want to leave you with something actionable, because knowledge without action is just anxiety. If you have had blood work done in the last 12 months, go back and look at it again. Not through the lens of normal versus abnormal, through the lens of optimal versus suboptimal. Here are the longevity optimal ranges for the markers most likely to be on your existing results. Fasting glucose 72 to 85. HbA1c below 5.4%. Triglycerides below 75, HSCRP below 1.0, vitamin D 40 to 60 nanograms per milliliter, homocysteine below 7. If any of your numbers are inside the conventional normal range but outside these optimal ranges, that is your signal. You are in the suboptimal zone. You are not sick, but you are not protected either. And if your most recent blood work did not include fasting insulin, ApoB, or homocysteine, you have blind spots. Consider requesting them from your GP. You can say, I have been reading about cardiovascular risk markers, and I would like to add ApoB and fasting insulin to my next panel. Most GPs will agree. If they do not, a private blood test for these markers costs less than a decent dinner. The important thing is to stop accepting normal as the goal. Normal is not optimal, and the gap between the two is where preventable disease lives. If you want to see where you stand across all 6 pillars of health, not just blood work, but sleep, exercise, stress, nutrition, and supplementation, I have built a tool for exactly that. It is called the Executive Longevity Scorecard. It is free, it takes 8 minutes, and you receive a free personalized PDF report that gives you a clear picture of where you are strong and where the gaps are. The link is in the description below and in the pinned comment. Subscribe if you want more of this. I publish every Tuesday and Thursday. And if you know someone who just had their annual health check and was told everything is fine, send them this video. It could change the way they think about their health. I will see you in the next one.